If you or a loved one are currently going through chemotherapy or radiation, one of the common side effects is what's called peripheral neuropathy or pain in the extremities, peripherally. So the chemotherapy induced peripheral neuropathy, it's called CIPN. It also includes radiation, but it's one of the most common side effects for those undergoing breast cancer. So depending on what they use for the chemotherapeutic agent or the dosage of the radiation, the occurrence rate is upwards of 85%. Now, there's no real options out there for people right now. You're either given a medication that usually just kind of covers up the symptoms, but it really doesn't stop the problem, which is the toxic effects on the nerve. So you're covering up the symptom, but not really helping heal the nerve. So that stuff, unfortunately, will hang on oftentimes even after chemotherapy is finished. It can occur in the legs. You can feel that down in your feet. You could get it in your hands, and you can get it just about anywhere. So it's not uncommon for the treatments to be halted due to the extreme side effects of peripheral neuropathy. It's pretty debilitating at times. So we're kind of we open an office here in Omaha. We're offering a new and viable option for people with neuropathy. Most time people think of diabetic neuropathy, but chemotherapy-induced peripheral neuropathy is a very, very common side effect of that treatment. So we're trying to look at it instead of just covering up the symptoms, we're looking at the whole picture. So we're looking at the nutrition or the metabolic aspects of how do we fuel or feed that nerve, then how do we activate that nerve and activate it within its tolerance, if you will, its nutritional or its metabolic tolerance, and then how do we make you functional? How do we either do orthopedic or balance kind of approach to let you live your life again? So we're taking a kind of a new approach. We're getting really good results, and we're really happy what we're doing. But no promises of cure. So we'd be happy to sit down with you if you feel like you might want to look into this. The great thing about it is it can be done in conjunction with your treatments or even afterwards, just depending on how you feel, of course. But give us a call. Attain Health Omaha. It's 402-505-3210. All the best.